The COVID-19 pandemic has brought new challenges for healthcare providers, including the way teams work together and communicate. In today's podcast, the American Society of Anesthesiologists and the AHA's Physician Alliance have partnered to share experiences and lessons learned as a result of COVID-19. They're looking at how clinical and administrative leaders are working together to lead their teams through this crisis. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Bruce Flantz, President and CEO at New York-based Medisys Health Network, and Dr. Antonietta Moresco, anesthesiologist and chairperson of anesthesia at Medisys Health Network.
Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. Really pleased to have today's podcast brought to you in partnership with the American Society of Anesthesiologists. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance. I'm joined today by Bruce Flantz, President and CEO of Medisys Health Network, and Dr. Antonietta Moresco, anesthesiologist and chair of anesthesia at Medisys. Today, we're talking a little bit about the learnings and experiences as a result of COVID, specifically taking a look at that role of collaboration between the clinical and administrative leaders that really enabled this team to be more effective together. So to get started, can you each tell us a little bit about yourself? Let's start with you, Bruce.
Well, thank you, Alyssa. So as you said, I'm the president and CEO of Medisys Health Network. I'm also a member of the AHA RPB2 and the chairman-elect of the Hospital Association of New York State. At Medisys, we are a small health system. I'm going to give you a little bit of a context, not meant to be a commercial, just so you understand a little bit about our organization. Medisys is a small health system located in Queens in New York City, which happens to be the epicenter of COVID-19. Queens has a population of about 2.3 million people, and we are the most culturally diverse county of the 3,000 counties in the United States, where the people of Queens speak about 135 different languages, and our employees, we have 6,500 employees, speak about 100 of those languages. We're very reflective of the community. Our organization consists of two safety net hospitals. One's a 400-bed level 1 trauma center with a stroke center. It's also the closest hospital and trauma center to JFK International Airport. And our other hospital is a 300-bed community teaching hospital. We also have a 228-bed skilled nursing facility. We have a very extensive ambulatory care network of 750,000 visits per year, and we have jumped into value-based payments with both feet, and we take full capitated risk on a population of 148,000 individuals. We have about $1.5 billion in annual revenue, and the payer mix of our organization is 60% Medicaid, that's 60% Medicaid, 20% Medicare, 5% uninsured, and 15% other, which consists of commercial, no-fault, and workers' comp. And as I mentioned earlier, we are in the epicenter of the COVID-19 crisis, and at our peak, we had over 500 inpatients with COVID-positive coronavirus, and of that number, 150 were on ventilators.
Dr. Moresco?
Yes, good afternoon, Alyssa, and thank you for this opportunity. I am Antonietta Moresco, and I presently serve as the chairperson of the Department of Anesthesiology for the Medisys Health Network. And I've been here as part of the team for about 30 years. I also represent the American Society of Anesthesiologists as the clinical champion for the CMS Quality Payment Program. Here at Medisys, the anesthesia service is a private corporation, and it's subsidized by the Medisys Corporation. We are a staff of attending anesthesiologists and a few CRNAs. We provide anesthesia services to outpatient and inpatient surgical and procedural cases. We cover obstetrics and neurointerventional procedures, and we are a level 1 trauma center at the Jamaica site. So the anesthesia staff is an integral part of the trauma service.
So I know you have a very strong team that we've profiled before in some of our webinars, but Bruce, can you tell us a little bit about how COVID, the crisis, really impacted your health system and how you prepared the team? And then Dr. Marisco, about how your own practice had to shift.
Sure. So I've been a healthcare administrator for 48 years, 45 years at Medisys, and we have never seen anything like this in my entire career. Let me just give you a brief history because we've been very involved in disaster response, and that helped prepare us significantly for this event. Starting back in 1992, we responded to the devastation that Hurricane Andrew caused in Homestead, Florida, and we had teams on the ground there for 3 weeks, reopening up Homestead Hospital. In 1998, we had a similar relief effort where we went to the New York State North Country, which was devastated by an ice storm, and we staffed the ICUs up in the hospital in Watertown, New York. In 2001, with the World Trade Center, our ambulances were some of the first on the scene. As a matter of fact, one of our 8 ambulances was destroyed when one of the towers came down. And then we had teams of mental health professionals there for over a week providing mental health support for the first responders. Back in 2005, we were on the ground in Louisiana and Mississippi after Hurricane Katrina. And in 2012, after Superstorm Sandy hit New York City, we were very involved in our own community responding to that disaster for over 3 weeks. And then in 2017, after Hurricane Maria devastated Puerto Rico, we sent teams of 20 people who were on the ground there for over 2 weeks. And most recently, in February of this year, in response to a request from Governor Cuomo, we sent teams of mental health professionals to help people who were impacted by the earthquakes in Puerto Rico. So we've learned a lot of lessons from these different disaster response efforts, and I'd like to share some of those with you. Our team developed expertise in emergency management. As soon as we anticipated the crisis with COVID-19, we formed our 6 work groups, the first being our project management work group. The second was our clinical care work group. Third, staff education and training. Fourth, ancillary and support work group. Fifth, we had our human resources and workforce safety work group. And lastly, our inventory management work group. We learned additional lessons from our disaster response efforts, and very importantly, how to do surge capacity planning. And that was critical because early on in this process, the New York State Health Commissioner mandated that by Monday, March 23rd, we have a surge capacity plan that could be implemented immediately that would take us to 50% over our licensed capacity. But that quickly changed the very next day, and within 24 hours, the governor decided that surge capacity needed to be 100% over our licensed bed capacity. And in addition to what we planned for with that, we also planned for our normal surge capacity planning, which includes space, supplies, and staffing. And lastly, one of the most important lessons we learned along the way is the value of relationships, which I'll refer to later on.
Great. And Dr. Marisco, you went from being an anesthesiologist to suddenly having all sorts of additional responsibilities. Can you tell us a little bit about how this impacted you?
So with reference to our specific practice, around mid-March, we were directed to cancel all elective surgery. So we followed CMS's guidelines to cancel all elective cases, but we needed to continue to provide urgent and emergency anesthesia services, including trauma, obstetrics, and neurointerventional. The cancellation of cases, along with the increased demand of PPEs, became a revenue strain. At the same time, we were involved in the critical care surge that was occurring. The critical care units were all COVID patients, but the surge continued. So we had to convert our operating room recovery area, neurointerventional recovery area, and our ambulatory surgery area to critical care units. Normally, we have 26 ICU beds, but we surged to 111. The anesthesia staff went on rounds with the ICU intensivist, and we also were preparing for the possibility of needing to provide long-term ventilatory care to the COVID patients on our anesthesia machines in the OR in the event we would not have enough ventilators. Also, I worked closely with the director of respiratory therapy, and the anesthesia staff began to provide support to the therapists by going to rapid responses.
Amazing. Just a wonderful testament to your team. So in that vein, can you share the thing that you're probably most proud of in your response to COVID? What was the thing that was most helpful or that you're most proud of across your system? Bruce?
So, Alyssa, maybe I'll start and then I'll turn it over to Antoinette. So the thing that we're most proud of is the great teamwork that we have here at Medisys. We have a long history of the team working together. As I mentioned earlier, I'm here 45 years. Antoinette's here 30 years. Most of our leadership team, both clinical and administrative, are here probably on the average of 25 years or more. So we have a tremendous amount of trust in each other. We really focused on staying ahead of the issue as much as possible, and that led us to want to make sure that we provide as much safety for our team as possible. So we, right from the beginning, had enough PPE for our team to feel safe, and the staffing was addressed early on. And as Dr. Marisco is sharing with you, people's willingness to do anything that was required of them was critically important. I want to emphasize that all decisions during this period were based upon saving lives. So when the number of ventilated patients tripled from our normal volume to over 90 just on the Jamaica campus alone, we got very concerned that it would threaten the liquid oxygen supply. But we were able to transfer patients. It allowed us to rebalance the load. And as I spoke earlier about the value of relationships, that came into play as we try to figure out how to effectuate these transfers. So to decompress the load, we decided, because all New York City hospitals at that time were overloaded, that we had to transfer outside of the region. So we transferred patients to the Albany area, which is about 150 miles north of New York City, and that proved to be very, very important. Another thing that we did that was very important during the height of the crisis was that we were able to send a number of our ventilated-dependent patients to the U.S. naval ship Comfort that was docked in Manhattan. As a matter of fact, we were the first hospital that was able to send them ventilated-dependent patients.
Great. Dr. Marisco, from your perspective.
What stands out clearly, and I'm so proud of, is the response of the staff. Whatever they were asked to take on, they just did it. Whether it was the anesthesiologists, aiding the respiratory therapists and the ICU intensivists, and covering our own colleagues that fell ill, in addition to everyone wanting to provide help to the medicine staff. Our ambulatory clinicians were managing inpatient floors. The surgical attendings and surgical residents were working in the ED to cover ED physicians that had fallen ill to COVID-19, and also the surgical staff formed a central line service. The ophthalmology, dentistry, and podiatry residents were all helping the medical residents. It was truly all hands on deck. And also the administration and leaders of the task forces and their teams was so readily available in delivering whatever we needed, particularly PPE, supplies, and equipment. Most helpful was that when we went for face-to-face meetings to WebEx and conference calls within the institution, I had WebEx conference calls set up with myself and the anesthesia staff. So every morning I'd provide them with information from our institution's daily safety huddle, information that was regarding the number of admitted patients in the ED, the number of patients that were COVID positive, the number of PUIs, number of patients on ventilators, and it allowed for them to also be able to voice any concerns or questions that they had. In fact, even some of the staff that had fallen ill were at home and they'd be calling in to know what's going on. The other thing that was very helpful was also while we were surging, the American Society of Anesthesiologists was providing weekly webinars that related to issues such as repurposing our anesthesia machines and protocols to providing critical care management. The website is truly a tremendous resource and support.
I couldn't agree more. I know when we were gathering clinical resources, that's one of the sites we point folks to from the AHA website as well. So, Bruce, can I ask you to share something that maybe surprised you about the COVID crisis and maybe something you might do differently if you'd had the opportunity to go back?
So what probably surprised us most was how quickly this ramped up. Just to give you an idea, in 1 week from Tuesday, March 24th, between the two hospitals, we had 184 COVID patients. 1 week later, on Tuesday, March 31st, that number went up to 415, and of that 415, 150 were on ventilators. Just to give you an order of magnitude, over the last 2 months, of the 3,500 admissions to our hospitals, 2,200 were COVID-positive patients. That's 63%. And during that time period, we still had to function as a level 1 trauma center, a stroke center, advanced cardiac services, deliver babies in our OB program. But we were able during that period to discharge over 1,250 COVID-positive patients. We still have over a couple hundred patients that are still COVID-positive in-house. But I'd like to share just one quick success story. So when we were ready to discharge our 1,000th patient from our Flushing campus, it just happened to be the Flushing chief nursing officer who had been sick with coronavirus for over a week in the hospital, and he himself was our 1,000th discharge patient with the disease.
So it really was all in the family.
Right.
What about you, Dr. Marisco?
What really surprised me the most was that about 35% of the anesthesia staff fell ill in just a matter of a few days. So the concern became not only the scheduling and continuing to provide services, but also I began to, be concerned for the staff's well-being. I called them every day just to see how they were doing. In fact, very early on, we realized this was taking a toll on our staff, and the organization initiated a wellness program. Also surprising was the presentation of varied symptoms of the patients. So at first, we were screening for fever, cough, shortness of breath, and then we started having patients coming in with nausea and vomiting and diarrhea, testing positive for COVID-19. So we were truly learning as we were going along, and even the build for documentation in our EMR was constantly changing. It was just living in the moment and learning as every moment we went along the way.
It sounds like this was definitely one where I know I'm certainly hearing a lot of the clinical teams really learning as they go very much. Every day there was a new set of symptoms, a new set of discussions about what the best treatment options might be and what to be looking for. So what I'm hearing from at least the first part of this, very much the two lessons I would take away in terms of how you all work together as a team and were able to handle this nearly tripling of your at least ICU patients and the huge surge. The two things that really came out loud and clear were open lines of communication and a great amount of trust across your team. But Bruce, what are the lessons that you're taking out of this event?
So, Alyssa, you're right on target. I would say communicate. So we have a daily 8:30 situation awareness calls. We continue to have our daily 10 a.m. hospital-wide safety huddle, which Dr. Marisco has been running for a number of years now. We have weekly work group meetings. I have done about a dozen video messages that we post up on our own intranet. Just everything that we can do to keep our team members informed. And we have three guiding principles, one of which that you referred to. So our three guiding principles are trust, respect, and security. You have to trust each other. Number two is you have to respect each other as knowledgeable, experienced professionals. And three is you have to be secure in yourself that you're always doing the very best for our patients. And as Antoinette said, just one example of that teamwork is that when one of our team members is out with COVID-19, we really call them, we communicate with them just to give them as much support as we can in their effort to get well.
Absolutely. Dr. Marisco, what's the lesson you're going to take home from this?
The lesson for me is relating to the atmosphere of collaboration that we've always had and has existed in this institution between the clinical services and administration. This crisis actually took us to another level, and it was incredible to see the amount of support that everyone had and gave to each other.
Wonderful to hear. So for our listeners, I ask that you give us some advice for those who maybe either haven't experienced the peak or, might be looking at a similar situation of pandemic, whether it's a pandemic or a crisis. What advice would you have to share with our listeners?
Use this time effectively to prepare, and then prepare again. We've never seen anything like this before. And very importantly, keep safety of your team members as paramount. That's why we always made sure that people felt protected by having enough PPE, and that we always provided enough staff, which is absolutely critical. We learned that you make the best decisions you can based upon the information that you have at the time, but what we found is that the information was changing so rapidly that the decisions had to change just as rapidly.
So really a lot of flexibility needed, huh?
Yes, absolutely.
All right, Dr. Marisco, what advice would you share with your colleagues?
So I agree with Bruce. Communication is absolutely key. Bruce also did 12 recordings that provided information to the staff and always thanking them for their hard work. Prepare to have enough PPEs, equipment and supplies, because the PPEs is what the staff is always asking for and concerned about. And lastly, plan as much as you can for whatever time frame you have, knowing that the situation is so fluid that you need to be as flexible as possible, because the plans can change within 24 hours or from 1 hour to the next.
Thank you so much for sharing your experience and what you learned. And I'm so proud to even know that such a great team is taking care of my home community. And all the great work that you're able to do there.
Well, thanks so much, Elisa. We know you that you were born and raised in Queens, so we're glad you never forgot us. And it's truly a pleasure to work with the American Hospital Association as well as the ASA.
Yes, Elisa, Thank you so much. I really appreciate this opportunity.